If you're a woman over 40 that has been experiencing some annoying and frustrating hip pain, especially limiting you from doing more activity and exercising and walking or running, well, you're not alone. This is a very common thing women go through for different reasons. And today I am going to help you find a more natural solution to help ease your hip pain. 4 secrets that you may not realize or were told that can help you. My name is Dr. Dawn Andalone. I'm a women's health physical therapist. I have helped thousands of women overcome hip and pelvic issues. And today, hip pain is one of the most common things that we see in women who are trying to be more active, but are in that level from 40s, 50s, 60s, and beyond, and feel like this wasn't such an issue when they were younger, but now sometimes when they get out of a chair or they've been sitting for a while, or even when they go on a longer walk, this nagging hip pain is stopping them in their tracks and they're not sure what to do. So why is this even happening? Well, your hips are the part of your body in females that are structured a little bit differently than men. We also have childbearing hips, and so even if you haven't had a baby or you have had a baby, there are changes in your bone structure over time, and those ligaments can become a little more stretched out and lax, and therefore we have more stress on our hips, needing more muscle support around your core, your glutes, and your pelvis. Your hips do change with age, and also those hormonal shifts in from your 40s and beyond going toward menopause. It changes a lot to do with the soft tissue structure, even your pelvic floor muscles, those deep muscles in the vaginal wall. Those muscles do start atrophying and change as estrogen drops. So you have less support around your pelvis, and knowing what to do to build up that area and provide a better support around there, and also changing up some of the activities that you're doing is going to be very beneficial for finding a more natural solution and relief from hip pain. So targeted stretching is going to be the first thing that I want to address with you when you're trying to solve your hip pain. Now, if you're getting a lot of sharp shooting pain into the groin area, or you can't walk for long enough around your house, it is getting worse, then you definitely want to get checked out by a doctor, get an x-ray or an MRI, and see what they recommend from there. But if you have some mild to moderate arthritis, or you have any soft tissue issues around your hips, these stretches can be very beneficial for you. So the first one is a figure 4 stretch, and this is going to open up your hips and also create some stretching around those deep hip rotator muscles, which can create a lot of stress and pressure around your hip, especially at your bursa on the side, if bursitis is a common thing that I see as a physical therapist. And so doing this figure 4 stretch, you're crossing one ankle over the knee and you're pulling that leg towards you. And you can see my back is supported here, and I'm gonna hold for about 30 seconds to a minute and do twice on each side. That can be very beneficial for opening up the hip there too. Now, if this pinches in the groin and it's uncomfortable to do, well, you can also put your bottom foot up on a wall and then just press that knee away from you, and don't come up as high, because if you're getting pinching in the front of the hip with any flexion type exercises, well, you may have some irritation in the front of your hip joint, and so you don't want to overstress it and overpinch it there. But a hip rotator exercise, stretching out the glutes and the piriformis and the deep pelvic floor muscles, that is going to be very helpful. The next thing that I love is a good hip flexor stretch. We want to open up the front of your hips, and this helps for your stride length when you're walking. And so your stride is going to become very shortened, and you're not going to be able to use your glutes, your big supporting muscles around your pelvis and your hips, your power muscles. You're not going to be able to use them efficiently if you have a lot of tightness and shortening in the front of your hips. So here's a good hip flexor stretch. I am using a Pilates barrel, but you can do this over your couch, an arm of a couch. It doesn't have to be this high, or on your bed, have your foot behind you. and you stay up nice and tall and aligned, and you can even hold a chair or something in front of you for balance, but you get a good stretch here. This is better than just pulling your foot toward your butt like a quad stretch. Why? Well, if you're in good alignment and you're kind of squeezing that glute underneath you as you do the stretch with the leg behind you, then you're gonna open up that joint in the front of your hip. That's what we want, to get more mobility and keep those hips flexible, especially for weight bearing and walking and squatting. Next is strength training. I did mention your glutes are such a good support around your pelvis, and strength training for your core, your hip muscles, and all those muscles that support your pelvis is going to be very beneficial. Well, one of the exercises that a lot of women don't know how to do correctly, or even were never told how to do this exercise, or maybe it's intimidating to you, well, it's a deadlift exercise. And this is going to work the muscles all through your backside, which also help for the power of walking and squatting, and being able to use those power muscles are going to support your pelvis in a better way. So you can use a weight. I have 12 pounds here just to show you, but you do want to lift something that's heavy. How do you know if it's heavy enough? Well, if you feel like it's challenging by about 8 to 10 reps, you are using the correct weight. This is going to be fairly light for me, but I'm just going to demonstrate and show you. So I'm going to turn this dumbbell up and down. You can also use a kettlebell or a bar, but I'm going to set that weight right between my legs. And it's different from a squat. I'm not doing this, but I'm flexing at my hips, and see how my back stays straight? So if I flex from my hips, my knees just bend a tiny bit, maybe about 10 degrees. And my back stays flat. I pull in through my core muscles, my abdominals pull in, and I lift from there. So you can see it's kind of like a seesaw, teeter-totter. I'm not rounding my back. You want to stick your butt back. Think of sticking your tailbone behind you. And you can do a set of 15 of those. I love deadlifts, and when women are experiencing any back pain or hip pain, they often fear a deadlift exercise, but if you're doing it correctly, it can feel so powerful because it really helps eliminate some of that pain and stiffness, because you're working and training the brain to connect to those bigger muscles of your body. So the next thing is changing up your activity. Maybe you're doing too much high intensity or impact exercise that's irritating your hip. So switching to upright bike, cycling. A recumbent bike, you can compress a little too much in the front of the hip joint. So having more of an upright bike and not using really heavy resistance, but that also can just change up the activity that you're doing. Or switching to some swimming, walking instead of running, or jumping, or higher impact activities. Those can also be helpful. And just looking at what you're doing, is it too much for your joint right now and it just needs to back off and rest, and you work on more of that restorative exercises while things are healing, but you can still get your cardiovascular workout by doing swimming, by doing some cycling, and changing up your activity too. You can also think about walking on a softer surface. Sometimes I will go to a soccer turf field, and therefore it's a little more squishy and a little more giving. It's actually a lot more comfortable on my knees and my hip joints, and feels better, and you can walk longer that way too, rather than walking on the pavement. Now, one of the last hidden secrets, I find that a lot of women, they are not told about this, or it's not when they're Googling and researching things, but one of the hidden secrets, I want to tell you a story. We had a woman in her 60s, was seeing a physical therapist for like more than 6 months, a long time, and she was only getting so much better with her hip pain. It was just like maybe 50% better, but it was not getting to that point where she felt like she could do all the activities. So she was seeking out other information, and she came across an article that was about how pelvic floor therapy can also help with hip pain. Now, your pelvic floor are those deeper muscles in your vaginal wall, but it has such a connection to your whole pelvis because it's really working from the inside out. So if something is going on with your pelvic muscles, they're too tense and tight, or they're weak, you are gonna put stress on your body in different ways, which can lead to hip pain as well. And muscle imbalances are a huge thing that we're looking at as pelvic floor physical therapists. So we're not only looking at how the pelvic floor is functioning, but how is your core, how is your lower back, and those outer hip muscles all working together. Well, sure enough, after 2 to 3 sessions with a pelvic floor therapist, she was able to go back to doing like 90% of what she wanted to do. And this is just over a couple weeks, not over a matter of 6 months. So if you're not seeing results from a traditional route of seeing a regular physical therapist, you might want to seek out seeing a pelvic floor specialty therapist or learning more about pelvic floor health. I have a helpful video on this channel about breathing exercises and relaxing and decreasing tension in the pelvic floor muscle area, and that can be a great place to start. So I will link down below that video and you can go back and watch that. But finding some relief in knowing that your pelvic floor muscles are functioning properly, they support your pelvic organs like your bladder, your uterus, your rectum, and they're also so important for weight bearing. So therefore your pelvic floor has to support kind of like a trampoline, constrict when it's needed, but then relaxed when you're at rest too. And if you spend a lot of time sitting, the pelvic floor muscles may be tense and tight, and they need some special attention to try to release them and learn some strategies and techniques to do that. So those are the hidden secrets to helping solve your hip pain in a more natural way, or easing some of your symptoms if you just haven't found relief by some of the things that you're trying already. Are you doing all 4 of the things that I've recommended in this video? Comment below and let me know if that was helpful. And if you haven't subscribed, please do. I release new videos every week, all about popular women's health topics in relation to fitness and health. And I'm here to help you age with vibrance and feeling your best self. So thanks so much for listening, and we'll see you again.